Hi, this is David Schwab. Thanks for watching this very brief but informative video on 5 critical reasons why patients accept treatment. This video is brought to you through my collaboration with Schedule Widget and presented to you as a value add for being a customer of Schedule Widget. So I want to talk about the 5 critical reasons why patients accept treatment, and then I want to tell you about my new webinar called Practice Management by the Numbers, Countdown to Success, that's available for you and your study club at no charge. But first, let's get right to it, the 5 critical reasons why patients accept treatment. I would like to list the 5, but then I want to talk about the interplay of the 5, how they work together. Now, these are reasons that motivate patients. They spring internally from the patient, and the patient says, if I can get these benefits, then I might be really interested in accepting treatment. The first is aesthetics. Everybody wants that beautiful smile. The next is function. Patients would like to eat the foods they choose to eat and eat comfortably without any discomfort. The next is health. I know you can talk very knowledgeably about the relationship between oral health and general health. The next one is prevention. This isn't just hygiene, which is very important, but it could be solving small dental problems before they become large dental problems. That's part of prevention. And last, and probably one of the most important ones, is quality of life. Patients want to enjoy high quality of life. So when we think about these 5, I want you to think about them not in isolation, but how they might work together. For example, a patient is missing a posterior tooth and you recommend that they have the tooth replaced. And the patient says, well, it's not bothering me now. Nobody sees it. So really, what's the benefit? Well, there could certainly be a functional benefit. We could talk about that. There could be a prevention benefit because we don't want a one tooth problem to become a multi-tooth problem and have a cascading effect. And then if that did happen, you start having health problems, shifting teeth, maybe super erupting teeth, teeth that are shifting out of position, harder to clean, harder to floss. And then we start getting into periodontal issues. And eventually, if the problem gets really bad and everything gets totally out of whack and the occlusion is really bad and the teeth are shifting, you could certainly talk about quality of life issues that would start to creep in because they're starting to have problems, and even aesthetic issues because it could affect the aesthetic zone. So we could turn one tooth problem, you have to explain to the patient, could become really a full mouth problem. And now the benefits of treatment could touch all 5. Or, as I have orthodontists tell me, sometimes they talk to patients about function, they talk about aesthetics, but if you think about it, there are certainly orthodontic benefits that touch on health, prevention, because we don't want to have malocclusion and we don't want to have issues with crowded teeth, harder to clean, periodontal problems down the road. And obviously, orthodontic treatment has a quality of life benefit. So any treatment you present, ask yourself, how many of the 5 can you touch? And even if it's something like veneers, and you say, well, veneers, I guess that would only check the aesthetic box. It would check the aesthetic box, but also the quality of life box, because when people look in the mirror, what's their self-image, what's their self-confidence? Just about any procedure that you can think of is going to be related to not just 1, but maybe 2, and in some cases, all 5 of these critical benefits. So here are the benefits again. And when you present your treatment plan, think about how many of these 5 you can touch upon that might be related to the treatment plan, because these are the benefits that people are looking for and the reasons that people will accept treatment. I've just given you a sneak preview of my new webinar called Practice Management by the Numbers, Countdown to Success. This webinar is available for you and your study club at no charge. The webinar is live, it's not recorded. You pick the time, we'll do it over Zoom. Whether you have a large study club or a small study club, whether it's formal or informal, let's get it scheduled and we'll do the webinar, which is full of all sorts of terrific information. The webinar includes topics such as 7 confident responses to the money objection, 6 action steps to higher case acceptance, and many, many more. We count it down, 7, 6, 5, 4, 3, 2, 1. You don't want to miss this because it's got terrific information. So how do you get this webinar so that you can not only get patients into your practice, but also convert them to raving fans, convert them to the kind of patients who refer their friends and family. And of course, it's all because they recognize benefits and they are accepting treatment from you. So let's get the webinar scheduled. My contact information is available. It's right on the screen. And if you don't remember anything else, just remember my website address, which is davidschwab.com. You can contact me through that website, davidschwab.com, but you also see my email address, my phone number, so you can text me. It's all right there on the screen. So I really look forward to talking to you about scheduling the webinar. Oh, and you say, well, what's the catch? Wait a minute, you say there's no charge. What's the catch? Well, you're right. There's always a catch. The catch is that there's limited availability. So please contact me now. First come, first serve. And I look forward to presenting the seminar for your study club, big or small, whatever group you have. I look forward to presenting the webinar. This is David Schwab. Thank you very much.